Hello students and welcome in the online session of class 9 subject science chapter 13 why do we fall ill. This is the third video of this lesson. Let us see which topics will be covered in this session. So today we will do infectious diseases, then vaccination, some common viral diseases and their prevention. So among these we'll cover hepatitis, rabies, polio and AIDS. So let's start with the topic principle of treatment of the infectious diseases. So other concepts related to infectious diseases are covered in the previous session, like how the infectious diseases spread, what are the different sources of the spread of these diseases, and now symptoms and signs also covered. So let us now start with the principle of treatment. How infectious diseases can be treatment and what is the basic principle behind it? What is the basic idea behind treating the infectious diseases? So there are two ways to treat any infectious disease. Okay, so by two methods infectious diseases can be treated. So first one is to reduce the effect of the disease. First method is to reduce the effect of the disease. And the second method is to kill the cause of the disease. Okay, so you all know that what is the cause of the infectious diseases? Yes, the cause is the pathogens, the germs. Okay, so second method is to kill the germs. Okay, so first method to reduce the effect of the disease, and the second method is to kill the germs. Now, proper medicines can reduce the effect of the disease. Okay, if we are taking some proper medicines related to that infectious disease, then it can definitely reduce the effect of the disease. So, you can see here many of the medicines. And second thing, that antibiotics, if taken, they are very helpful to kill the pathogens. Okay, so pathogens can only be killed by antibiotics. Other medicines can only reduce the effect. Okay, suppose we are taking painkiller, so painkiller will reduce the pain, but painkiller will not kill the germs. Germs can only be killed using an antibiotic medicine. Okay, so let us see what are the antibiotics then. So antibiotics are the chemicals. Okay, because antibiotics are either in the capsule form as you can see here, or they can be in tablet forms. Okay, circular tablets or oval shaped tablets. There are different shapes tablets are available. So antibiotics are generally the chemicals which are produced by the microorganisms which at low concentration levels have the ability to destroy or inhibit the growth of the pathogens. So antibiotics are nothing but the chemicals only which are produced or which are made by using the microorganisms only. Okay, by using the dead bodies of the microorganisms only, and very little dose, very little concentration of the antibiotics has the ability to destroy the pathogen or to stop the growth of the pathogens. Fine. So antibiotics are those medicines, are those chemicals which are made by using the microorganisms, and in a very small dose at a very low concentration they have the ability to destroy or to stop the growth of the germs. Then antibiotics can also be of two types. Okay, generally the antibiotics are working on the bacteria. Okay, so anti means opposing. Okay, so the medicines which oppose the bacteria, they are called the antibiotics. So antibiotics are of two types. First one is broad spectrum antibiotics and the second is narrow spectrum antibiotics. So broad spectrum antibiotics means which can work on a broad range of bacteria, means which can work on many species of bacteria. Okay, many types of bacteria. Fine. So this broad spectrum antibiotics, they kill a wide range of bacteria. Many different types of bacteria can be killed by using broad spectrum antibiotics. And narrow spectrum antibiotics are those which are effective against only a few type of bacteria, which can only function on a specific bacteria. Okay, they cannot function on all the types of bacteria. They can only function on some specific bacteria. If you have some of the antibiotic bottle at your home, you can check out whether it is a broad spectrum or a narrow spectrum antibiotic. Fine. Then the next one is principles of prevention of diseases. Okay, now what is, how can we prevent from the disease, how can we save ourselves from the disease? So there is some principle behind. So following are the limitations with the infectious disease. Let us first see the limitations, like when the infectious disease occurs, then actually what happens. So once someone gets a disease, his body function gets damaged. Okay, body functioning stops, body function gets damaged or body functioning get changed. Fine, so this is one of the problem. Then treatment of a disease takes time. Okay, once anybody gets infected by the disease, then it will take time to recover. So this is also one of the problem with the infectious disease. Then person suffering can serve as a medium to spread the disease. Okay, and as we all know that infectious diseases can be spread from a patient or from an unhealthy person to a healthy person. So this is also a problem, that if a patient or if an infected person is in the society, then there are more chances of the spread of the disease. So these are the three limitations, or you can say these are the three problems with the infectious diseases. Okay, first one, that the body functioning stops or get changed, malfunctioning of the body. Then treatment of the disease takes time, so time goes there. Then person suffering can spread the diseases to the other healthy person also. Fine, so now what has to be done? So we can say that prevention is better than cure. Okay, this line you have to, this is very common line, but it has a deep meaning inside. Prevention is always better than cure. Curing a disease is very difficult, but preventing a disease is easy. Okay, so prevention is always better than cure. It is very important to prevent. Prevention means that you are protecting yourself from the disease, and prevention can be done before the disease starts. Once you get the disease, then only thing possible is to cure it. Okay, to treat it. So, disease should not enter the body, so always take preventive measures. So, what preventive measures can be taken? So, the first one is public hygiene is the basic key. Okay, public hygiene. For all the infectious diseases, the basic concept, the basic term behind is to maintain hygiene, personal hygiene as well as public hygiene also. And second thing is proper immunization. Okay, proper immunization means immunity of the body has to be increased. Immunity means resistance power of the body against the germs. So that power has to be increased. Now, how the immunity can be increased? It can be increased either by taking healthy food. If you are taking a very healthy food, that will increase the immunity. And the second method by which the immunity can be increased is by taking proper vaccines. Okay, and you all know that vaccines are always given before the disease. Fine, so proper vaccination, proper injections must be given to the children at the starting ages of their life. Okay, so proper vaccination is a must, and whenever there is some vaccine available for any disease, everyone should take it to protect their life against the diseases. Now, the next topic is vaccination. Okay, so vaccines are the antigens that are injected or swallowed. So vaccines are nothing but they are also the chemicals. They are actually the antigens. Antigens we call to those bodies which are helpful to develop antibodies. Okay, so once vaccines go inside the body starts making antibodies. Okay, that's why we say that vaccines are antigens. Okay, when you take medicines, then the body is not, start making antibodies. But once you take antigens are the special proteins only which help in which once inhale which once taken inside the body, they are helpful in the production of antibodies. Fine, so we are saying that vaccines are the antigens, or you can use the word chemicals also here, there is no problem. So vaccines are the antigens or the chemicals that are injected or swallowed. Fine, so you can see here in the picture that the vaccine is injected. Okay, it is given with the help of the injections, or it can be given orally and then it can be swallowed. Swallowed means directly taking inside without, chewing. As it is a liquid, so it is directly swallowed. So vaccines can be either injected or they can be swallowed. And you must know that vaccines are made by using the dead bodies of bacteria and fungus. Fine. The dead bodies of the microbes or the germs are used to make the vaccines. Now, when the vaccine is given, so actually what is going inside? The dead body of the virus and the fungus, bacteria and the fungus. Now, when dead bodies of the bacteria or fungus are taken inside, so now body will treat them as a foreigner. Okay. So what the body will start? Body will start fighting with those germs. Body will activate its immune system. Okay. And then body will starts producing antibodies which can fight with those germs. And once the antibodies are produced, they will remain inside the body only. Now, they were the dead bacteria and fungus. But in near future in life, whenever such bacteria, virus or fungus enter the human body, then the body recognize those germs and antibodies are already prepared. Okay, and again they start making such type of antibodies and they actively start fighting with those germs. So this is the main function of the vaccines. Okay, so it causes the development of active immunity in the patient. So when the vaccines are given, the immunity of the patient increases. Small quantities of antigen introduced in the person's body stimulate the production of antibodies. Okay, so once you have taken the antigen or the vaccine, then the body starts making antibodies. Okay, as if the body is infected. So, body is treating itself as the body is infected because they are dead bacteria and dead virus inside. So, body is treating that the body is infected. So, body starts producing antibodies. Fine. Now, next time when the microbe actually enters the body, okay, these were the dead ones, but in life, suppose sometime the microbe enters the body, then the immune system responds to the infection. Okay, immune system will identify this infection. The body will identify the germ more quickly. Okay, because once the dead bodies have entered inside, so now the body will identify the germ very quickly. Fine. And very quickly the germ will be identified and body will start fighting with that germ with the help of the antibodies. Okay, so this is the basis of immunization. So this is the whole working or the procedure of immunization. That what is the importance of immunization? What happens when the vaccines are taken? So when the vaccines are taken, body starts making the antibodies, and in near future, actually when the germ enter, the immune system gets active. Immune system will identify the germ very quickly, and antibody production will increased up, and the body will fight with those germs, and the body or the human will be protected against that disease. Okay. Now, so immunization or immune system can be activated by giving vaccines. So here is a chart in which some of the vaccines which are given to the children are given. So some of the names we must know that the first vaccine given in the chart is BCG. Okay, it is a full form is Bacillus calmette guerin. So you need not to learn the complete name. You just learn BCG vaccine. Okay, so this BCG vaccine is given against tuberculosis to protect the child against TB, tuberculosis. Okay, and when it is given at the time of birth and up to 1 year of age. So, two times this vaccine is given. Then there is another vaccine which is called as DPT. Okay, diphtheria, pertussis, tetanus. Okay, so this is the full form. You need not to learn it, only you learn DPT vaccine. Okay, so, three doses of this vaccine are given in the age of in the 6th week after the birth of the child, then in the 10th week and in the 14th week. Okay. Then next is OPV. It is the oral polio vaccine. Okay, oral doses. Polio vaccine is given orally in the mouth. So OPV vaccine, it is against the disease of polio. Okay, DPT was against diphtheria and tetanus. Fine. And then hepatitis B vaccine is also available. This is against the disease hepatitis B. Then measles vaccine is given to protect the child from measles. And then TT injections, TT vaccines are there, tetanus vaccines for the disease tetanus, and Japanese encephalitis. Okay, this is to protect the child from brain fever and swelling in the brain. Okay, so these are some of the vaccines. You need not to learn all, but BCG, DPT, polio doses, some of the names you must know. Okay, hepatitis B vaccine is given so that if the question comes related to vaccines, you can quote some of the examples. Fine. Now, next topic, we are starting with the common diseases and their preventions. Now, we will study about some of the diseases in the humans. So, diseases can be caused by virus, they can be caused by bacteria, they can be caused due to fungus, they can be caused due to protozoa. So, let's start first with the viral diseases. Okay, viral diseases means the diseases which are caused due to virus. So, among the viral diseases, now first we are starting with hepatitis. Okay, so let us start in with the different headings. So, in hepatitis, first of all, you must know what is the causative agent. Okay, causative agent means which virus is causing this disease. Okay, so causative agent is hepatitis virus. This you have to learn. Okay, I have given here in very short form only causative agent, then mode of transmission, symptoms, and prevention. Like this, I have divided the topic. So, you have to learn in this format only. So, hepatitis is caused by hepatitis virus. So this virus damaged the liver cells. Okay, so in hepatitis, what happens? The liver cells get damaged. Then there is acute inflammation in liver. Inflammation means burning sensations. So there is a little burning sensation in the liver, and this hepatitis, if not treated on time, it can result in jaundice. Okay, jaundice in Hindi it is called pilia. Fine. So it can lead to jaundice also. Now, you must know that hepatitis are of five types: hepatitis A, hepatitis B, hepatitis C, D, and E. Out of these five types of hepatitis, hepatitis A and B are very common in humans. Fine. Now, let us know the mode of transmission, from where this virus comes. That is the mode of transmission, how it is transmitted, how it is spread. So, it is through the contamination of food and water. Okay, if spoiled food and infected water are taken inside the body, then hepatitis A and B can be caused. So, contamination of food and water is the main mode of transmission. Now, let us discuss some of the symptoms of it. Okay, what symptoms can be seen in the patient? So, first one is fever and loss of appetite. Okay, loss of appetite means the person will feel dizziness, giddiness all the time. Okay, and the memory will not work properly. So, this is loss of appetite. Fever, nausea. Okay, the person will not, feel very happy to eat the food because the person feels nausea. Fine. Then vomiting is another symptom. Then jaundice may occur. Then dark colored urine. The color of the urine changes to dark yellow. Okay, so this is also one of the symptom. Then itching in the skin. Skin can also get itched. Then headache is one of the symptom, and joint pains are also the symptoms for this hepatitis disease. Now, let's see how it can be controlled. Okay, so in the diagram also you can see here, very beautiful diagram. Here you can see this red colored organ seen is the liver. Okay, and this is the hepatitis virus picture. So this virus infects the liver cells. So that is shown in the diagram only. So how can we control it? Okay, so there should be complete bed rest given to the patient. Then intake of carbohydrate rich food means the patient must take carbohydrate rich food. The food which is rich in carbohydrate should be given to the patient, and low intake of proteins and fats. Proteins and fats should be given in less amount to the patient. So, in by using these tips, the disease can be controlled up to certain limits. Then, what is the prevention? How to prevent the disease? How can we protect ourselves from this disease? So, first is eating hygienic food. Okay, proper hygiene food and water should be consumed. Water should be safe, it should not be contaminated. Food should be hygienic food. Okay, proper, clean, neat, covered food must be taken. Then, next prevention is proper immunization. Okay, vaccines must be taken for hepatitis A and B so the immune system can be activated. Then using disposable syringes. Okay, whenever syringes are used, they should be disposable. One used syringe or injection should not be used for the other person. Then proper cleaning of the hands. Hands should also be, Personal hygiene and public hygiene is the preventive measure for each and every kind of disease. So, this point you can write everywhere. So, this is all about hepatitis. Now, let's move on to poliomyelitis. This is the complete name for polio. Poliomyelitis, or in short, we call it as polio. So, what is the causative agent? Means which virus causes it? It is polio virus. Okay, you can see a picture here. The limbs get paralyzed. Okay, in polio, the limbs get paralyzed. So, it can be legs or either hands, sometime get paralyzed due to this virus. So, virus causes paralysis in the limbs. Paralysis means there is no sensation in these parts. Okay, limbs are not working actually. Then, what is the mode of transmission? Mode of transmission is that this virus enters directly or orally through the mouth, it enters the body, or directly with the contact with the patient, it can also enter. Okay, then it reaches the this virus reaches the intestine part, and through blood it reaches the central nervous system. Okay, suppose it enters through the mouth, then directly it reaches to the intestine, and from the intestine along with the food it reaches through the blood. And when that virus containing blood reaches to the brain, that it affects the central nervous system, it affects the brain, nerves as well. Okay, so you will find inflammation in nervous system, so the patient will feel burning sensation in the nerves, and muscle functions failure, muscles will not function. So you can see here paralysis, so muscles are also not working in these parts. And now what are the symptoms? Symptoms are, first symptom is headache and fever, then stiffness in the neck, the neck gets stiffed. Okay, the neck, it is difficult for the patient to move the neck rotations or to do the neck rotations. Then paralysis of the limbs. Paralysis means that no proper blood supply to this area, and the muscles of the limbs, legs or hands, they get weak, very 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 weak, so the person get paralyzed. Then respiratory failure. Okay, there will be problem in the respiration also. And how it can be prevented? It can be prevented only by immunization with polio vaccine. There is no treatment for it. It can only be prevented by giving polio vaccines. Okay, if a patient gets polio, then it is incurable. After the disease, it cannot be cured. So it is always, controlled by giving the polio vaccines. And you'll be happy to know that in India there was the polio campaign started by the government, and now India is completely polio free. Okay, India is declared as polio free zone. So there is no polio patients now, but before it was there were many polio patients. But after the government campaign against polio, so it is eradicated from the country now. Fine. So polio eradication programs are were started by the government of India, and now India is free from polio. But still, you must be aware that whenever polio doses are given, every time the small kids up to the age of 5 years, from birth up to the age of 5 years, whenever government is setting any campaign against polio, the child must be given those oral doses. As many times as you can, the oral polio vaccines should be given. Okay, and you know that slogan also, do boond zindagi ki, right? So 2 drops only of that vaccine is given to the child. Now the next disease which you have to study is rabies. Okay, so causative agent is rabies virus. So this is also a viral disease caused by rabies virus. Now let's see what is the mode of transmission, how it spreads. So this virus enters the human body with the saliva of infected animal. Okay, you can see here a dog is infected by rabies virus. Fine. So if such type of rabid animals means the animals in which this virus is present, like dogs and cats. Okay, especially dogs and cats. So once the virus enter their body, so they get rabies. And if such animal bites a human being, then you can see this part, how much saliva is given out of the mouth. Okay, so this saliva, if such type of animal bites the human, the saliva get mixed with the blood of the human, and the virus enters the human body also. Okay, and this virus destroys the brain and the spinal cord. Okay, this virus destroys the brain and the spinal cord, so all the nerves and the brain gets damaged due to this virus. Okay, so it's a very harmful virus. And what is the mode of transmission? With the bite of rabid dogs and cats, with the bite of such animals which are having rabies virus in them. Then what are the symptoms? So first symptom is severe headache and high fever, then painful contraction in the muscles, pains in the muscles, then inability to swallow. The person is not able to swallow the food or water. Okay, not able to take the food inside through the throat region. Then restlessness, the person will feel restlessness. Then infected person afraid of water. This is the main symptom of it, that the person will feel afraid from water. That is called hydrophobia. Okay, afraid from water. So this is one of the symptom of rabies. Then let's see what is the prevention. Prevention is rabid animals to be killed. If any domestic animal which has got this type of virus, if you find such, in animals, salivation, more saliva comes out of the mouth, salivation, and the tongue, the tongue also they keep outside along with the saliva. So this is the main identification mark of the rabid animals. Okay, so if you find any such kind of animal around in your surrounding areas, so main thing is to kill those rabid animals, because again there is no treatment till now for rabies. There is no medicine for rabies. So it is first thing that rabid animal should be killed. Then if somehow, if after so much prevention, if still any rabid animal bites the person, that wound where the animal has bite, so the wound should be cleaned with soap and water immediately after the bite. Okay, suppose a rabid dog has cut the human, so that wound area where the dog has given a bite, that should be washed with soap and water immediately. Fine. And other prevention is anti-rabies vaccines to be given. So anti-rabies vaccines to be given to the domesticated animals as well. Okay, humans are very fond of keeping the pets, dogs and cats. So the domesticated animals should be given these anti-rabies vaccines always. And how to control it? There is no treatment till now, so it cannot be controlled. There's no treatment of rabies. Okay, only if you see any rabid animal, just kill it, and still the animal has given a bite on some human body, then it should be cleaned with soap and water. And after a dog gives a bite, whether the dog is having the virus or not, but still if any dog gives a bite, then the person has to take 14 injections. Previously it were 14 injections were given in the stomach area, but nowadays that number has reduced to 3. So nowadays only 3 injections are given in the stomach area near the navel part. Fine. So if any animal has given a bite on the body, so the person must take those preventive injections too. Okay, so here in the picture also you can see a rabid dog here. So you can see here the salivation from the mouth, and the tongue is also out. Fine. So what is the source? Now we have studied that rabid animals, here it can be a dog, it can be a cat, it's a bat, it can be a bat, then it can be a rabbit also. Okay, so these animals can be the carrier of the rabies virus. And what is the treatment? Treatment is only to give the vaccine, anti-rabies vaccine. Okay, and symptoms, now we have discussed the symptoms also, that the person is afraid of water. If you bring water near to the patient will feel afraid. Okay, and then some more salivation in the mouth. Fine, muscular pain, the person feels restlessness. So these are some of the symptoms. And what first aid can be given if a dog or cat, if the rabid animal gives a bite, then the wound area should be immediately washed with soap and water. Okay, so this is the first aid which can be given in case of rabies. Okay, so this is all about rabies. Now the next viral disease which we have to study today is AIDS. Okay, so let us first discuss the full form for AIDS. So it is acquired. A stands for acquired. I stands for immuno. It is not immune, immuno. D stands for deficiency, and S stands for syndrome. Acquired immunodeficiency syndrome. It's a very fast spreading incurable disease. Keep it or note it that it's an incurable disease. There is no treatment for AIDS. And causative agent is HIV virus. Okay. You might have heard whenever there is a blood test, HIV test is done along with it. So HIV means the full form of HIV is human immunodeficiency virus. H stands for human, I for immuno and immunodeficiency, and V stands for virus. So human immunodeficiency virus. Now let us discuss the mode of transmission. Okay, so first mode, you might have seen many of the ads in the televisions also related to AIDS, how it spreads. So the first one is unprotected sexual contact between the partners. Okay, unprotected sexual contact can lead to the spread of AIDS. Then second is use of contaminated needles and syringes. Okay, if a person has used some contaminated needle which has already been used by some AIDS patient, like that, razors, even in the barber shop, one must be very careful. Used razors should not be used. So use of contaminated needles can be one cause. Then transfusion of infected blood. Okay, you can see in the picture here, if a blood carrying the virus is transfused to a healthy person, okay, if you are in a hospital and if the blood is not screened before transfusing in the body, then the virus can enter the body of a healthy person. So whenever blood has to be given to the patient, first it has to be screened well that it should not have any kind of HIV virus. So transfusion of infected blood can also be one of the cause. Then organ transplant. Okay, some organ is transplanted. Okay, some organ is replaced by a new organ in any human body. Then that organ must be tested before for HIV. Then this can be spread from infected mother to the baby. You can see here, if the mother is infected, so there are more chances that the baby of the mother can also get infected by this HIV virus. So these are some of the modes of transmission: unprotected sexual contact, then use of contaminated needles and razors, transfusion of infected blood, organ transplant, and infected mother to baby. Then what are the symptoms? Okay, so here in the diagram you can see that World AIDS Day is celebrated on 1st December. So you have to learn this date. 1st December is celebrated as World AIDS Day. Then symptoms are sweating at night and weight loss. Then ulcers. Okay, repeated diarrhea, again and again loose motions, decreased blood platelets. Okay, blood platelets number decrease. Then continuous fever, severe brain damage, loss of memory, susceptibility to other infections. Means if a person is having HIV virus, then other infections, other germs can also attack, because this HIV virus actually, it weakens the immune system. Okay, it weakens the immune system. That's why the name is acquired immunodeficiency. So there is a deficiency of immune system in the body of the patient. Immune gets weak. Okay, so body is unable to fight with the germs in that case. So the other infections also increase in that case. Okay, so how it can be controlled? It can see, there is no vaccine for AIDS, there is no treatment pills for AIDS. So how can it be controlled? It can be controlled by immunostimulative therapy. Okay, means when the person gets this virus, so the patient is given immunostimulative therapy. Such type of medicines are given which can increase the immune system of the patient, but it is incurable completely, it cannot be cured. Okay, so immune system can be little more increased, or can be made active by giving immunostimulative therapy. And how the it can be prevented? As we know that there is no vaccine for AIDS, so the first thing, it can be prevented, that every person must be educated about AIDS. Every person must know how AIDS is spread, what is AIDS. Fine. So education must be given to the people about AIDS. Then people must not use or share the razors and needles. Okay. Then blood bottles should be screened before transfusion, and there should be protected sexual intercourse among the partners. Okay, so this can be done by use of condoms. Okay, so these are some of the preventions which can definitely control the AIDS. And as I have told you that AIDS is uh, a condition in which the immune system of the patient becomes very weak, right? Like suppose someone has become HIV positive, that does not mean that the person has AIDS, but slowly and slowly, once the virus enters the body, what the virus will do, the virus will weakens the immune system. Okay, so after 10 or 15 years, means after a long time, after many years, or that depends from person to person. So after years, what will happen, slowly and slowly that virus which is present inside will weaken the immune system, and one stage will come when the person's immune system will be so much weak that even the person cannot fight with the small germs also. Fine, and that condition when comes, that then it is called AIDS, and that is called as syndrome. Okay, so that it's not actual a disease, it's a syndrome. Syndrome means it's a condition. It's a condition in which the immune system of the person becomes weak. There is deficiency of the immune system in the body. Okay, so if any person gets HIV virus in the body, that person should take very proper care of himself or herself, proper hygiene to be maintained. Okay, then a balanced diet has to be taken, proper medication has to be taken, regular exercise has to be done to keep themselves healthy and fit, because if any germ enters the body, then it is very difficult to treat it, because immune system slowly and slowly gets weakened. Okay, so this is all about AIDS. Now let us see the summary what we have done today. So we have seen about the prevention of the infectious diseases, then vaccination point, then some common viral diseases we discussed: hepatitis, rabies, polio, and AIDS. So that's all for today's video. We'll meet in the next video. Till then, all of you stay home and stay safe.